Yes, sir, the screen is visible now.
Okay. Namaste Sharade Devi Veena Pustakadharini Vidyarambham Karishyami Prasanna Bhava Sarvada. Hari Om. Welcome all of you. In this series of clinical orthopedics, we came across first was ankle joint, then it was wrist, knee joint, and now we are coming up with elbow. In case of elbow, there is only one reference. I got only one reference, that is Masurikante Shothaha Syat Purpare Manibandhake Tatha Ansafalake Chapi Dushchikitsaha Sudarunaha. In complications of Masurika, there is Shoth in Kurpara Sandhi, Manibandha Sandhi, and Shoth at the site of Ansafalak. It is Dushchikitsya in nature. So, it is the only reference, specific reference regarding Kurpara Sandhi. So, if there are any other references, you may be knowing. If you come across any other references related to Kurpara Sandhi, then please tell me regarding the same. Now, this Kurpara Sandhi is a very different type. It is a very complicated joint. First, these are courses related to MUHS, and this is now we are coming up with rheumatology, dermatology, and cancer care. So, basically, in case of history taking related to elbow, it is important to ascertain the exact site and distribution of pain and its nature also. Nature of pain is also very much essential in this case. Pain arising locally in humerus is easily confused with pain arising in the shoulder. Pain arising locally in the humerus, actual at the site of humerus shaft, it is easily confused with pain arising in shoulder. Characteristically, it radiates to a point about halfway down the outer aspect of upper arm. Elbow pain is mainly localized precisely to that joint, though it is a diffused aching pain and is often felt in forearm also. When ulnar nerve is associated with the pathology, it is interfered with behind the elbow, and the symptoms are mainly in the hand and forearm also. So remember one thing in your mind, that elbow pathology is related to pain radiating towards half or full forearm also, while In case of shoulder pathology, it is limited up to upper arm only. So first thing, we have to be very much clear with the site and nature of the pain. History of previous injury is very important in case of elbow. Maybe it is long ago in case of childhood also, but it may be significant. So proper history taking is needed in case of elbow. Injuries in this region have very late effects in the form of maybe restricted movements or stiffness in the joint, impaired movements, arthritic elbow joint, maybe loose body formation, or the most important is there are more than 20 to 23 muscles at ulnar elbow joint, but the main ligament there is medial collateral ligament, one of the main ligaments, and interference with the ulnar nerve is one of the main complications of Kurpar Sandhi, Shodh and Shul. So we have to be very much careful related to ulnar nerve. In case of examining this particular joint, the whole length of upper limb should be considered, and it is to be compared with the other hand, with the other normal hand. That is very much essential. See, in case of local examination of elbow joint, if you find no pathological impairment or something like that, then we have to investigate thoroughly the neck, the brachial plexus, the shoulder. So, in case of elbow joint, first, if you do not find any particular point, any particular history of any particular examination point by palpation of elbow joint, if you find no pathology, if you find no impairment or nothing like that, then please examine the brachial plexus, please examine neck for the pathology, or please examine shoulder as a whole. In a case of shoulder, we will definitely come across shoulder also. In case of shoulder, please examine shoulder thoroughly. So these are the main important points related to this elbow joint. Now let us come to one specific case. Osteochondritis Desiccants. In this case, I am talking about loose bodies in elbow, which is the commonest investigation, which is the commonest diagnosis in case of elbow joint in general practice. So how we are approaching to that loose body is very important. First is osteochondritis desiccants. In this case, we will come across 1 to 3 loose bodies. In case of osteoarthritis, sclerotic changes will be there in articular surface. Along with that, you may see 1, 2 or 3 loose bodies, osteoarthritis, in case of osteoarthritis. If there is a fracture with a separation of a fragment, you can see, but it is easily diagnosed with the help of X-rays. And the fourth one is synovial chondromatosis. Synovial chondromatosis is seen in case of knee joint also. There was a BAMS lady whose father was diagnosed with synovial chondromatosis at our clinic, which was operated because he was having around 20 to 30 loose bodies in his knee joint. So it was operated and patient was relieved with the pain, and he was relieved as restriction of movements of elbow joint were there. See, in this case, in this osteochondritis desiccants, a fragment may rarely be detached from capitulum. Sometimes medial epicondyle is also detached and it floats on that joint, retaining its attachment to flexor muscles. It is very important and you have to diagnose it properly with the help of proper investigations. It may resemble like tennis elbow also, but palpate it and you will come to know that it is a loose body. Medial epicondyle is detached, that you may see in X-ray also. Necrosis of part of articular cartilage and of underlying bone with eventual separation of the fragment is the pathology in case of osteochondritis desiccants. In case of osteoarthritis, there must be history of fracture or overuse of elbow joint. Mainly in case of traffic police, you may get it history of overuse. Fracture with a separation of a fragment, history of trauma is there always. And in case of synovial chondromatosis, that is osteochondromatosis, though it is a rare disease, I have seen 3 or 4 cases of synovial chondromatosis. So I would like to tell you about this, only 2-3 points regarding this. See, it is a disease of synovial membrane. In synovial membrane, there are many synovial villi that becomes pedunculated and they get transformed into cartilage, and then eventually they are detached and they form loose bodies. After forming loose bodies, they become calcified also. Many a times, these loose bodies are silent. There are no symptoms as such. Why there are no symptoms? I have told you about that in previous lecture also. मक्खन का गोला अगर हम लेते हैं और उसमें आप 10-12 स्टोन्स रख देते हो तो मक्खन के गोले को कोई फर्क नहीं पड़ता, बट आप ऑपरेट करने जाओ तो दैट इज बिट डिफिकल्ट फॉर a surgeon. So, yes, Dr. Gary, thank you very much. In case of uh, what I was talking about, हाँ, अगर ऑस्टियो बहुत सारे उसमें लूज बॉडीज है और अगर वो मक्खन के गोले में रख दे तो कोई फर्क नहीं पड़ता, वो साइलेंट होते हैं. These loose bodies are silent in nature and it has nothing to do with pain or any other things, any other symptoms rather. Often in such cases, fragment is not in fact loose but has soft tissue attachments that prevents its movements in the joint. So they all are attached with the help of some soft tissues. And freely movable loose body, characteristic of freely movable loose body is sudden locking of the elbow during movement with sharp pain. Joint is usually unlocked after an interval. In case of knee joint also, you may experience locking because it is a very common symptom in case of knee joint. But in case of elbow also, it gets locked. Either spontaneously it gets free or by patient's try. It may get free. Several hours later, several hours after locking of the joint gets swollen. Symptoms easily subside within few days, but it may get repeated after some period, after a periodic time. The symptoms again flares up. Again, elbow joint gets locked, and you may find difficulty in that. So, this is the main thing related to loose bodies. Examination in this stage of swelling, that the joint to be distended with fluid, maybe clear fluid, maybe a straw colored effusion is there. Between the attacks, loose body can be felt. In case of attack, you may not feel loose body because of effusion fluid in that particular area. Many a times there is a history of cause of loose body formation, maybe trauma, maybe overuse or whatever, but there must be some history related to it. So that is very important in this case. So if there are 1 to 3 loose bodies, there is no problem as such, but still the patient is having a locking problem on and off, then he has to go for surgical intervention. In case of osteoarthritis of elbow joint or osteochondritis desiccants, we use Athi Majja Pachak Yog, that is Guduchi Amalaki Musta plus Panchadikta Grutagugul in oral medication. Along with that, we use Shothahar Lep plus Pindatel for Lepan. Even Upanaha works well in case of locking. After in between 2 locks, we have to use other medicines along with Lep. In case of effusion, we mainly use Shothahar Lep or effusion along with redness, we use Jaloka for symptomatic relief. So these are loose bodies in the elbow. Use Panchadikta Gruta Gugul in oral medicines, which will reduce pain plus stiffness plus range of motion will be improved in these cases. Can loose body dissolve? Can we dissolve loose body? The answer is no. We cannot dissolve the bodies, and with the help of you cannot challenge it that you can dissolve a loose body. It may happen or it may not happen. There is a matter of chance only, nothing else. In case of Panchakarma, in case of Snehan, mainly we use Vishagarbha Tel while if there is severe pain, Sahachar Tel if movement is restricted. In case of Shoth, along with locking and along with pain, one has to go for Saindavadi Tel as a matter of as oil of choice. In Sthanik, Avagaha Swed is very much useful. Please put elbow joint at least for 20 minutes in Sariva Siddha Jal or Ushir Siddha Jal when it gets locked. Patrapotali Pinda Swed is also a procedure of choice in case of loose bodies, mainly Nirgundi Patra Potali Pinda Swed is a procedure of choice. Agni Karma gives you temporary relief in pain. So mainly we use Rajata Chalaka, but in case of joints, please use Suvarna Chalaka for Agni Karma. When it gets red hot along with pain, there is no history of fracture. With radiograph, you are ruling out fracture. There is only Osteochondritis Desiccants or say loose bodies, say Osteo Arthritis, Kapha Pitta Avastha, that is first step of Osteo Arthritis. Then you can use Jalav Kavacharan as a procedure of choice. If you are getting excruciating pain in Vata Vyadhi, it gets controlled with the help of Agni Karma. But after 2 hours, after you administer Agni Karma, after 2 hours of that, if you get excruciating pain again, if pain is repeated again, then please think of Jalav Kavacharan is a drug of choice, because speed, that is gati, is and excruciating pain is mainly related to Rakta Dushti and not related only with Vata Dushti. So Jalav Kavacharan is essential in this case. If you are getting pain and acute tenderness at the origin of extensor muscle of forearm, strain, see, pain is aggravated by putting extensor muscles on the stretch. Extensor muscle, that is the origin of extensor muscles is lateral epicondyle. The point of greatest tenderness is at the front of lateral epicondyle. You all must be knowing about this diagnosis, and this diagnosis is known as tennis elbow. It is a very common diagnosis related to Purpara Sandhi. It is caused by strain of forearm extensor muscles at the point of their origin from the bone, that is lateral epicondyle. You need not have to play tennis to get tennis elbow as a disease. If you are just reading a book for hours together and your forearm is your arm is stretched and forearm is flexed for hours together, if you are reading a book and if you are sitting at that particular at this particular position, then also you may get tennis elbow. So you did not have to go for tennis elbow. You did not have to play tennis elbow to get tennis elbow as a disease. There is incomplete rupture of aponeurotic fibers at muscle origin. This is a region having a tremendous supply of nerve endings, and in this case the joint is not affected, but patient gets severe pain. It is there at the lateral aspect of elbow, and it often radiates down back of the forearm. It radiates down to the forearm and backwards. So this is very important and cardinal sign of tennis elbow. If you are examining the patient, lateral epicondyle of humerus, you just put your thumb on lateral epicondyle of humerus and just press it. Patient gets severe pain. Pain is aggravated by putting extensor muscles on stretch. Flex the wrist and fingers with forearm pronated, and if you are doing movements of elbow, then you may get severe pain. In case of tennis elbow, patient gets pain for many months also. If he comes with say injury plus tennis elbow at your clinic, then it is very difficult to treat it in say 15 days or 20 days. You have to take you have to tell him to take the treatment minimum for 1.5 months. In case of tennis elbow, please go for Agni Karma with the help of Haridra Kanda. And in case of Panchakarma, again we use Vishagarbha tel as for Snehan, mainly when pain is severe. When stiffness is severe, go for Sahachar tel in case of Niramavastha. In case of liniments are very useful in painful conditions. Bruhat Sendavadi tel is also used in case of Shodh along with pain. Nirgundi tel is mainly used in case of severe pain only. In case of ligament injury, in case of ligament instability also, Nirgundi tel is a Pichu of Nirgundi tel is very much useful. Patrapotali Pindasved is used or Churna Pottali Pindasved, that is Ajmoda Churna Pottali Pindasved, is used in swelling of elbow joint. Shortwave diathermy is also used in case of pain. Agni Karma, we use Rajat or Haridra Kanda, but you can use Suvarna Shalaka also. Again, in case of Rakta Samsrushtata, again in case of excruciating pain, go for Jalokavacharan. It gives you very good result. So, Jalokavacharan is also one of the best treatments in elbow joint related problems. We use Rakta Mokshan in all types of joint disorders. Rakta Mokshan is the key of success in case of clinical orthopedics. Remember this. In any non-surgical orthopedic cases, first think of Rakta Mokshan, because that is the most important, most fantastic treatment, and it gives you fantastic, promising, good results. So think of only Rakta Mokshan first. Rakta Mokshan will give you a passage of time for your oral medication to work, for your other procedures to work. So immediately go for Rakta Mokshan. At least you will get a passage of 3 to 4 days, and in that 3 to 4 days you may apply lap, you may give some oral medicines that will help the patient in future. So these are all the things related to mainly tennis elbow. Many a times a patient comes to you with this particular problem, and that is known as olecranon bursitis, student's elbow. It is very commonly seen clinical picture in our patients. So bursa behind olecranon process gets swollen, and there are three main possibilities of these bursitis. First is traumatic, the most common clinical hetu, we can say, cause, we can say. The second one is septic. Septic bursitis is not so easy to treat. Get some synovial fluid and you aspirate it, and then you check it out. The third important point is gouty arthritis. That is the third thing, and these three are the main reason you have to go for uric acid in case of gouty arthritis. So, in traumatic bursitis, the bursa is distended with clear fluid, and in case of this, first you go for lap chikitsa, and in case of lap, first you apply shothahar lap or just apply Krishna bowl along with Gandha Biroja, or we have used only Punarnava, Vacha, Shunthi, Devdar, Haldi, that is Amra Haldi, and Sphatika. We have used this lap, and it also immediately reduces the shoth, reduces the bursa. We use it with only, we make a paste only with the help of water only, and that is also sufficient. We use it along with takra also, and it reduces swelling immediately along with stiffness. So, in case of olecranon bursitis, use lepachikitsa, and that is good enough. That is enough to reduce the swelling in 24 to 48 hours. Along with Danda Biroja, you can use Punarnava, you can use Mahaushad, Vacha, and Daru Haldi along with Fitkari. So, this is one of the best lab we use in our clinical practice as Shothahar. These are the main three diagnoses related to elbow joint which we come across daily in our clinical practice. In case of loose bodies in elbow, please think of asthi and majja as the main ingredients or as the main enemies that has to be corrected. In case of tennis elbow, think of Mausa, Vasa, Med and Snayu for the treatment. In case of olecranon bursitis, think of Pichha, Sandhi Bandha, Pichhadayascha Avayavaha. That is Prasad Bhut part of Ahar Ras is used to nourish Sandhi Bandhan and Pichhadi Avayav. In that sutra of Charak Sutrasthan 28, Pichha is related to Barsa. In case of loose bodies in elbow, think of different types of Google Kalpa. In first step, if it is Kafapitta Pradhan step, swelling is more and restriction of joint movement is more, then think of Trifala Google. When stiffness is 2+, when stiffness is 1+, think of Kaishor or Gokshuradi Gungul. If you have to go for Pachan or towards Asthi Majjagat, you have to do Pachan at the level of Asthi Majjagata Dosh, then think of Panchatikta Guruta Gungul along with Asthi Majjagata Pachak Yog, that is Guduchi Amal.